Government's disastrously good intentions. Number 7 on our list, big government healthcare. The ideas always sound so good even to my admittedly libertarian ears. Let's make sure every American can get health insurance. That was the noblest goal of Obamacare. So how's that working out? Peter Suderman is the senior editor at Reason Magazine, which I know well. Peter, thanks for joining us.
Thanks for having me. Always glad to be here.
You have written many times the phrases unintended consequences and Obamacare in the same paragraph. Tell us about what are some of the things that we have seen since this has been passed into law.
It is tempting to describe Obamacare as one big unintended consequence. Certainly it has offered a parade of them over and over again. So one of my favorites is that Obamacare sets up these things called accountable care organizations. Basically, they create incentives for healthcare providers, hospitals, doctors, etc., to consolidate into big units that are supposed to be able to take care of you holistically. The problem is that when you have consolidation in the healthcare industry, that gives providers more market power and drives up the cost of healthcare. In fact, this is so well known within the administration, within the executive branch, I should say, that the FTC has actually been suing hospitals that consolidate too much. So you have now this fight between two parts of the executive branch, one of which says, well, these hospitals, they're too big, and the other one is creating incentives for hospitals to get bigger. Another one you have is medical loss ratios. Medical loss ratios are this kind of wonky financial provision that says that insurers can only take 15 or 20% of any of their health premiums as for profit and for overhead and other things. The rest has to be spent on actual health expenses. But what that means is that they're limited in terms of the percentage of premium dollars that can be spent, that can be used towards profit. And so what do they have to do if they want to increase their profits? That means they have to increase their premiums. So you have all of these little tiny provisions within the law that were intended to do one thing, but in fact end up doing something completely different, often the opposite of what was intended.
Peter, let me ask you this. It seems, when I discuss this with people, it seems fairly simple. We want more of a limited resource for less money, and the best way that we tend to do that in every other area is the free market, where you have decisions, consumers making decisions about what they get. What is the allure of continuing to go bigger and more government involvement, and are there ways that we can extract ourselves from this pattern?
Part of the allure is that we've done it for so long and we've done it so much. You know, prior to Obamacare, nearly 50% of all healthcare dollars spent in the United States were government dollars. Obamacare adds to that a little bit. It depends on how you make the calculation. They're actually redoing the calculations in light of Obamacare. The way to extract ourselves from this is first of all just to put on the brakes, not to expand any further. We were expanding even before Obamacare. If you look at the S-chip debates, the Children's Health Insurance Program from back in 2007 when Bush was in office, and President Bush was looking for ways to expand health insurance to children through basically what is a Medicaid program. One of the unintended consequences there was a thing called crowd out, in which kids who already had private insurance were going to end up being on Medicaid, which is in most cases a worse program. And so the first thing that you have to do is just say stop. We're not going to do any more of this, and we're going to look for ways to simplify the system and make it work in a way that makes more sense.
All right, speaking of stop, let's go from healing the sick to cleaning the air. Number